Unfortunately, I asked them about their concerns. It's not uncommon that patients are concerned about the risk about allergic reactions. They are concerned about what it's going to do with them if they don't like the results. So it's important that you ascertain their concerns and try to alleviate their concern as much as possible. And then it's very important to establish their expectations, because some patients you just won't be able to deliver the results they're looking for. They may potentially belong to your surgical colleagues. Even more importantly, we want to dispel misconceptions. If a patient were to think that a cat is going to bark like a dog, you need to tell the patient that's not going to happen. So it's important that once you've established there is a misconception, you want to dispel that. What I then do is that I explain to my patients the aging process is a multifactorial process. It doesn't happen in the isolated part of the face, and at a certain age, just by doing isolated treatments such as toxin in the forehead or basic dermal filling in the nasolabial folds, that's unlikely going to give them an overall rejuvenation. Then very importantly, just like I mentioned earlier, the moment I start talking, I strategize my plan, and then I present them the options. And generally, I classify my options into two categories. One, an option that they can afford, and second, an option that I think that's best for them. Or sometimes it's important to present them with no option at all, because some patients, they belong to your surgical colleagues, or what they are describing as to what they are hoping to achieve is something that you're never going to be able to deliver within that financial constraint to begin with. So once you presented them with the options, more importantly, you want to present them with the limitations of the options. I prep my patients very carefully. I tell them the limitations of each of the options. They will either have to accept it or they will have to move on. Because it's important that we establish that we are on the right page, we are the same page as them, and they know what to expect. But at the end of the day, you're looking for a solution. And like what we talked about earlier, it's a balance between running a viable business and not neglecting your professional duty as a clinician. So we always have to think about this. I always believe as a clinician in the cosmetic industry, we have three things when we see our patients. We are a clinician, we are a politician, and we are an actor at the same time as well. So I present to them the different options, then I tell them what I would recommend they consider. And that is invariably, usually, my star procedure, which is overall facial rejuvenation. Then I look for cues. I look for signs of whether they are resistant to the idea or whether they are receptive to it. And if they are resistant to the idea, I will want to explore why. Because it's important to establish their idea, their concern, and their expectations. And once you sense that there is a degree of resistance to what you just proposed, you want to explore more into it and alleviate their concern as much as possible. And if they are receptive to your recommendation, then you can proceed with the procedure. The advanced advanced facial rejuvenation with contouring and volumizing requires a little bit more hand-holding. There are two questions your patients are likely going to be confronted with when they go home. Because if you such a dramatic and such a noticeable result, their friends and family are likely going to ask them two things. First, how much does it cost? Second, is it painful? So what I normally do is, and I always believe that the level of perception of pain is directly proportional to their level of anxiety. So I prep my patients very carefully. I tell them how I'm going to be anesthetizing them, and I reassure them that although the procedure may sound very advanced and invasive, but when it's done correctly, it's unlikely going to be uncomfortable. Your patients come to you for a medical procedure. Your patients come to you because you are a clinician, but at the same time, side effects and complications is not going to be enough. You need to give them the trust. So hopefully as part of your consent procedure, you will go through the side effects and complications, but even more importantly, you will have to tell them that if those side effects and complications in the unlikely event were to happen, you know what to do about it. So there's one thing knowing what the side effects and complications are on a theoretical basis, it's another thing knowing how to spot them and how to deal with them. What I normally do is I always have a microcannula sitting inside of my pocket, and I always want to show my patients what microcannulas look like. This is even more important if your patients have already had some basic dermal filling procedures completed by another practitioner elsewhere. The blunt microcannula comes with a little bit of prodding and tugging. If you don't tell your patients that it comes with that little bit of prodding and tugging, it's likely they are going to think you are a cowboy. So I tend to tell them the advantages of using that, as well as the disadvantages of using that instrument. But we'll come to a little bit more detail shortly. Even more imperatively, it's very important you do not rush. Even if you are running behind, it's very important you don't give the patient the impression that you are rushing. This is because it's likely you are going to get them to develop a complex, even more so, if they were to sustain any side effects or complication, they are going to likely think that is because you cut corners. This is my favorite product, Teosyal Alternate. Some of our colleagues have the privilege of having celebrity patients or patients with a lot of disposable income. But not all of us have that kind of privilege. And certainly where I'm practicing, people don't walk around with a lot of blank checks. So it's not uncommon that I would have to try to explain to them that why this product represents such a good value, or the value of the procedure is not determined by us, it's determined by the patient. But as mentioned in my previous slides, that there are two questions that are likely going to be confronted when they go home with such a dramatic and noticeable result. That is it uncomfortable and how much does it cost? So you want to furnish your patient with lots of information, well not lots of information, but some information about why you think Teosyal Ultimate and overall facial rejuvenation represents such a good value. What I normally say to my patients is that 3 ml syringe of Teosyal Ultimate may potentially sound expensive. In our part of the world, in the UK, we charge in the region of around £700 per 3cc per syringe of Teosyal Ultimate. That, for the majority of patients we see on a day-to-day basis, may come across as a shock because they're more used to hearing £150 to £300 per syringe of thinner filler. So they want to know why you're charging them £700. Just because you're one of the most famous doctors in the locality doesn't necessarily mean that you can charge that much. So you want to explain to them that mil per mil, Teosyal Ultimate is actually much cheaper than other products. And when that is coupled with superior lifting capability of Teosyal Ultimate, that 3 ml syringe will go a long way. Although Teosyal's brochure advertises that Teosyal Ultimate lasts between 12 to 18 months, but in practice, the majority of my patients get 18 to 24 months out of it. So it certainly represents a fantastic value for money. What do I tell my patients before the procedure? As mentioned in my previous slides, this is by far arguably the most advanced dermal filler procedure they are likely going to undertake, and therefore it's not uncommon that they go home and they scrutinize their face left, right, and center. There is this saying in cosmetic industry that whatever you tell your patients before the procedure is an explanation, but whatever you tell them after the procedure is an excuse. So I tend to prep my patients very carefully, and first thing I tell them is our faces are never 100% symmetrical, so it's important they know that before the procedure. And even after the procedure, although the symmetry of the face will be restored as much as possible, but it's never going to be 100% symmetrical. And again, with the use of cannula, I describe to them it's as if they are sewing. If they have a blunt needle, it's going to require a little bit of prodding and tugging. If it's a sharp needle, it would just go through any fabric. Massaging, I tend to tell them it may require a little bit of massaging, although it's unlikely I do much aggressive massaging nowadays. But you because there is lumpiness, it's firm because of the viscosity of the product. But you have another proportion of patients who call you in your office a few days later saying they can't feel it because they think the product disappeared. So I always correct my patient beforehand that if they are able to feel a little bit of firmness, that's normal. And if they're not able to feel it after a few days, that's equally normal as well. Longevity of Teosyal Ultimate, again, like I say, whatever you tell them before the procedure is an explanation, and whatever you tell them after the procedure is likely to be perceived as a form of excuse. So I tell them Teosyal Ultimate is likely going to last about 18 months. Some patients get about 24 months out of it. But when it's injected into somebody's tissues, there is a wide variability. One of the questions presented by one of the audience earlier was that what is the longevity of some products? And Stefan provided some excellent answers from a laboratory point of view. But in reality, the variability of hyaluronic acid, whether it's Teosyal Ultimate or any hyaluronic acid when it's injected, there is a wide variability. And this is a result of the aging process or the patient's lifestyle and an environmental factor as well. So I tend to tell my patients that before they leave the office. Very importantly, the product will not migrate, so they won't wake up the following morning. It comes to their nose. I had a patient who called me just before midnight to my mobile phone, and he checked with me whether she was allowed to lie down, because I had forgotten to tell her that the product is unlikely going to migrate. And I always see my patient back 3 weeks after the procedure. After the instructions, I keep it nice and simple. I don't give my patient a laundry list of aftercare instructions to cover my back, because they are unlikely going to read it, and for those who read it, they are unlikely going to remember. So I keep it nice and simple. That is 3 things for 3 weeks. What I tell my patients is, a disaster, but the symmetry we've just restored is unlikely going to be preserved if they start lying on the side. So try to lie on their back as much as possible for 3 weeks. And then for 3 weeks, try not to have any deep tissue massage. And then for 3 weeks, especially in our part of the world, that it's important to not cook the product, i.e. no sunbed, sauna or steam room for 3 weeks. In summary, the take-home message today is the advanced facial volumizing and contouring procedure, when it's performed well, can present your patients with some very dramatic and noticeable results. It is also precisely this that it is likely, when it's performed well within acceptable and reasonable cost, translate into increased patient satisfaction and in the process long-term patient loyalty. It is not uncommon 3 weeks after the procedure, when they come back for the review, they bring their friends and family for a consultation because they want something similar. I'm going to be showing you some before and after pictures of my patients. All of these patients, they have not had multiple syringes of products. They've all had only Teosyal Ultimate. And it's one way of illustrating how one syringe of Teosyal Ultimate, or maximum 1 or 2 patients, perhaps 2 syringes of Teosyal Ultimate, can yield such dramatic and noticeable results. And hopefully you will believe that those patients, I would like to think they were very happy with the results.